Hello, my name is Desiree Hernandez, and I'm a licensed clinical social worker, and I work at Mount Sacs Health Center. Today, I'm going to be discussing substance use disorders. But before we begin, I always remind people that this does not substitute for an official diagnosis. It is important to speak with a licensed professional so that you can obtain an accurate diagnosis based on your personal information. Please know that there are mental health services available to you with licensed professionals like myself at Mount SAC. You can call the Health Center at 909-274-4400 to schedule an appointment. Substance use disorders are among the top 5 mental health issues that impact college students. Before we get into more detail about substance use disorders, I want to do a quick exercise with you. Let's do a quick check-in and see if you can relate to any of these statements. I always encourage people to be honest with themselves, and the beauty of this moment is you're the only one who can see your responses. I've tried to stop or cut down on drug use before, but can't seem to stop. When I'm angry or upset with other people, I drink or use drugs. Sometimes I have to take one drug to get over the effects of another. I find myself making mistakes at school or on the job because of using drugs. Drinking and drug use has caused problems with my friends and family. Sometimes I feel scared at the thought of running out of drugs. I have stolen drugs or money to pay for drugs. I have been arrested or hospitalized for drug use. I find that I need larger amounts of drugs or alcohol to get high. I have overdosed on drugs. If you find that you relate to a few of these statements, you may want to further your discussion with a licensed professional. As you can see here, I have listed the National Substance Abuse and Mental Health Services Administration hotline, where someone is always available to assist you. Don't worry about any judgment, and I encourage you to let go of any hesitancies you may have about calling. You are worth that call. I believe that when we are engaging in discussions about any type of illnesses or disorders, we naturally want to know how many other people are living with this condition. Because of our natural need to belong to a group of people, we look for connectivity. Here is a slide taken from SAMSA showing the prevalence of substance disorders in the US in the year of 2019. In 2019, 61.2 million Americans had a mental illness and/or substance use disorder. Among those with a substance use disorder 2 in 5, 7.4 million people struggled with illicit drugs, illegal drugs. 3 in 4 people, or 14.1 million people, struggled with alcohol use. And 1 in 9, or 2.2 million people, struggled with both illicit drugs and alcohol. 51.5 million people aged 18 and older had a mental illness. 9.5 million people 18 or older had both a substance use disorder and a mental illness. Let's talk more about substance use in young adults in California. The National Survey on Drug Use and Health found that in 2018 to 2019, 10.5% met criteria for alcohol use disorder. 16% met criteria for a substance use disorder. 40.4% reported using marijuana. 7.7% reported using cocaine. 26.63% reported having any type of mental illness. So you can see that there are many young adults struggling with substance use disorders, and here in California. And it does impact your performance in college. According to these researchers, they found that college campuses are impacted by lower academic performance, a higher probability of unemployment after graduation, increased risk of committing or experiencing sexual assault, driving under the influence or having more accidents or injuries, and having student or academic discipline. Now let's talk risk factors. Like any other mental health disorder, substance use does not discriminate. It doesn't matter what race, ethnicity, sexual orientation, gender, or any other cultural identity. Substance use can impact anyone. Experts have identified some areas that may place you at a higher risk of developing a substance use disorder. Drinking at an early age, genetics, where there's a family history of a substance use disorder, environmental, including cultural and stressors. So the way your family and your friends view using drugs or alcohol, or if your surrounding environment is highly stressful, then you may be at higher risk of developing a substance use disorder. Other mental health disorders, sometimes people will self-medicate, meaning they turn to substances to cope with their mental health condition. Traumatic experiences, shocking, scary, or even dangerous experiences where you feel like your life is threatened can sometimes lead to developing a substance use disorder. Or even things like natural disasters, acts of violence, abuse, terrorist attacks, mass shootings, as well as car crashes and other accidents can all be very traumatic. Medical disorders. At times, having a medical condition can put you at risk, especially if you're being prescribed medication. Some medications can have addictive components. So if you're concerned about the medication that you're taking and you notice maybe you're needing more than what you are being prescribed, then you might want to talk to your prescribing physician about your concerns. Now, there are some college life factors that I think are worth discussing. The separation from family members can often put high stress on a college student, which might lead to using substances. Sometimes new social networks, a new group you're hanging out with, maybe there's more access to substances that you weren't ever exposed to before. And then not to mention the intense academic pressures. And then oftentimes students are looking to either use substances to cope with the pressures, or sometimes they use substances to enhance their performance. So let's talk substance use disorders and the DSM. The DSM is a diagnostic and statistical manual of mental disorders that licensed professionals use when diagnosing. The DSM categorizes substance use disorders by the following classifications: alcohol, caffeine, cannabis, hallucinogens like angel dust or LSD, inhalants, opioids like Oxycontin, Percocet, Vicodin, fentanyl, morphine, and codeine products, sedatives, hypnotics, or anti-anxiety medications like Xanax, Valium, Klonopin, Ativan, Librium, stimulants, including amphetamine-type substances, cocaine, and other stimulants, tobacco, and other or unknown substances. A person can be addicted to several substances at one time. So how do I know if I have a substance use disorder? Here are the general criteria used to diagnose a substance use disorder. Taking the substance in larger amounts or for longer than you meant to. Wanting to cut down or stop using the substance, but not managing to. Spending a lot of time using, or recovering from use of the substance. You have cravings and urges to use the substance. Not managing to do what you should at work, home, or school because of substance use. Continuing to use even when it causes problems in relationships. Giving up important social, occupational, or recreational activities because of substance use. Using substances again and again, even when it puts you in danger. Continuing to use even when you know you have a physical or psychological problem that could have been caused or made worse by the substance. Needing more of the substance to get the effect you want. This is called tolerance. Development of withdrawal symptoms, which can be relieved by taking more of the substance. Now, substance use disorders exist on a spectrum, meaning there are different levels of severity. Now, if you relate to 2 or 3 of these statements, then you might be diagnosed with a mild substance use disorder. 4 to 5 of these statements here, then you would be diagnosed with a moderate severity. And 6 or more would be a severe substance use disorder. No matter what level of severity, it is important to seek help for managing a substance use disorder, which leads me to treatment options. The great news is that there are many treatment options for substance use disorders. One of these options is psychotherapy or behavioral therapy, where an individual may meet with a licensed professional to discuss strategies to help them reduce or abstain from using substances, focusing on reasons why they are using, and then using replacement coping tools in order to avoid using substances. This could also be done in the form of family or group therapy, or all of them. Support groups are also a well-known method to treating substance use. You may have heard of AA or Alcoholics Anonymous, or NA, which is Narcotics Anonymous. Al-Anon and Alateen, these are actually support groups for family members of people who are using substances. So this is, again, a group support system in which you can share about your struggles, and you can find support or encouragement and be able to relate to others in order to overcome your substance use. Inpatient rehabilitation. This is where a person is a higher level of care, where the substance use is severe and requires a more controlled environment in order to decrease the urge or access to substances. And or a person might need medical oversight. In some cases, detoxing from a substance can be dangerous and life-threatening, and you'll need medical oversight in order to safely come off of the substance. For example, alcohol withdrawal can be life-threatening because of the detox that your body goes through. Common substances that require medical oversight are prescription opioids, heroin, benzodiazepines, these are the sedatives, and alcohol, as I mentioned. Medications are also a treatment option. These are combined with counseling and behavioral therapy, and they assist you with decreasing the urge to use. Or sometimes they can act as sort of tricking your brain into believing that you are taking the substance, but the medication is overseen by a doctor and is in a controlled environment. Specialized housing as well is available. Sometimes these are known as, you might know them as sober living or halfway houses. These are residencies where an individual will live for some time, and they are less restrictive than inpatient, but you still have to follow the rules and guidelines of the homes. Here again, I want to highlight the SAMSA's national helpline. Please know that it is free, confidential, 24/7. Anytime you need to call for help, and you can get information there, or you can find treatment there as well. I thought it would be useful to show you a brief navigation of the SAMSA website, where you can find further details about substance abuse disorders and treatment options. Now, I just want to let you know that we do not receive any endorsements or compensation for showing you this website. It's just a very reputable website, and it's sort of like a central hub for finding treatment. So here we go. Here is the SAMSA homepage, samhsa.gov. Here you can see that at the top here. And I just wanted to highlight a couple of areas. First, you could see that there's a navigation panel up here across the top in blue. And then we have some quick links down here as well. Finding treatment, I want to show you in a bit, but first, here's some public messages where you can find basically like learning more about different topics. Here's preventing suicide, marijuana risk, methamphetamines, adults and drug use. So different types of information here. I'm going to go back. So you can find that either here on public messages, or you can go down and there's some more quick links here. Okay, so that's one area I thought was really useful if you're just like looking for more information. If you're a stats person, then here's some data and quick stats. And they also go into detail about how they acquire the information. Now, most important here is the finding treatment. So you can find it there in the drop down, or you can find it here, findtreatment.gov. But let's click on find treatment, and this will take you out of the SAMSA website directly and into this kind of, it looks like a sister site. So, but here's where you can enter information here. So you could even enter, let's say, Walnut, California, because that's where Mount SAC is, and you hit search, and it'll come up with all of these potential treatment sites that you can explore through. So it's really nice that you can just like type things in and search on your own. But I do want to say, don't forget that you do not need to do it alone, and there's help here for you if you need help finding treatment and you want to discuss things a little bit more. So that's searching for treatment. Here's some more information on the different types of treatment options, a lot more detail than the brief overview that I gave you. And then information about who pays for treatment, how does that work? I think that's really important to review, understanding addiction and understanding mental health. So again, this is all through SAMSA right here. We can go ahead and go back home to SAMSA, and there's just a ton of information here. They even have like posters and things that you could look at that they publish. So I just thought it would be useful to know how to use or access SAMSA's website. At Mount SAC, you do have access to professional resources. Mount SAC Health Services employs mental health clinicians. They are located in 9E and 67B. Mental health services on campus are short-term, where you work with a licensed professional to develop attainable goals to improve your daily functioning. If long-term care is needed, then you will receive a referral for outside services or off-campus services. Substance use disorders are considered long-term care. And so Mount SAC, I just want to be clear that Mount SAC does not treat substance use disorders on campus. And so you will receive a referral to help you access treatment elsewhere. But please don't hesitate to call us for any assistance. You can call the Health Center at 909-274-4400, Monday through Friday, 8 a.m. to 4:30 p.m. And someone will be on the phone to assist you. I just want to say thank you for being here with me today and listening to this presentation on substance use disorders. I hope that you found some information useful. And if this information applies to you or a loved one, please don't hesitate to reach out for help. You are worth it. Please keep checking back for more Let's Talk series. If this is the first one you've checked in on, there are many on the Health Center's webpage that you can access online. Have a great day.